Hello, I'm Donald Macaulay from BJGP. Today I'm talking to Professor Michael Kidd, a GP colleague but also Deputy CMO to Australia. So Michael, tell me at the moment, where does Australia sit with the number of deaths, the number of cases, rolling out testing?
So Australia was in the fortunate position of being able to see what was happening in other parts of the world before the pandemic really came in force into our country. We saw what was happening in China. We saw then the rollout into other parts of Asia, particularly into South Korea and then to Japan and Singapore. We saw what happened in Europe initially, in Italy, and then moving into other countries and in Iran. And a decision was made very early by the Chief Medical Officer in Australia to recommend that the borders be closed. And that was probably the most important step in curtailing the impact of the pandemic in Australia. And then we saw an uprise in cases, as many countries did. We were getting to around 450, 500 new diagnoses a day. The testing, we had shortages of testing kits, so we knew that we weren't adequately testing across the population. But the cases, about a third of the cases in Australia have been from people coming from overseas, including Australians repatriating back to Australia. About a third came from cruise ships. We had a terrible problem with cruise ships coming into Australia and huge numbers of people being infected very rapidly on those cruise ships, and many elderly people, of course, on the cruise ships. And then about a third of the cases being community transmission. So the second decision, which was really important, was deciding to go into lockdown and going to lockdown quite early. And so people being told to stay in their own homes unless they were coming out for essential purposes, for shopping for essentials and for attending medical appointments if that was necessary. And rapidly we reduced the number of cases. We went from nearly 500 cases a day, then over a few weeks down to around 20 cases a day, and we've stayed at that level now for the last 2 to 3 weeks. We've had about 7,000 cases in total in Australia diagnosed, and we've had about 100 deaths, the majority of deaths being in elderly people aged over 70, or the majority aged over 80. We've carried out over 1 million tests in our population of 25 million. That means we're one of the countries which has carried out the most tests per head of population. And we're now pretty sure that we are picking up the majority of cases out there because we are seeing very little community transmission. We are still seeing outbreaks occurring in some parts of the country. We've had outbreaks around different industries. We've had, tragically, some outbreaks occurring in residential aged care facilities and nursing homes, with very significant death rates occurring in those settings. And interestingly, in Australia, the states have largely closed their borders. And so it looks like we're getting close to perhaps elimination in some of our states, in South Australia, Western Australia, the Northern Territory, and with most cases being reported in Queensland, New South Wales, Victoria, and in Tasmania, where we've had a significant outbreak in a couple of hospitals. So that's where we're at the moment. We've had a slight first lifting of some restrictions, and it's a very small step, allowing cafes to open and have 5 to 10 patrons in your cafe, which is a very small number. People are now allowed to go out and shop for clothes and other things rather than just for groceries. So retailers started to open up a little bit, and we have a 4-week period where we're seeing how this works. And at the same time, the country has invested in increasing our testing capacity. So we have a lot more tests being carried out, including targeted testing of residential aged care workers, of people now having elective surgery now that that's starting up again. We've increased our contact tracing capacity, and we now have a COVID safe app on our mobile phones. Nearly 6 million Australians have downloaded the app, which records whether you're in close contact with another person's mobile phone for 15 minutes or more. And then if you're diagnosed, that information, which is encrypted on your phone, can get downloaded and used by the contact tracers to follow people up. And we've increased our capacity, so when we do get an outbreak, we can move in very quickly, quarantine everybody who's linked to the outbreak, isolate everybody, and do the testing, and then provide what we need to do to keep things running. So in the outbreak we had in northwest Tasmania, 2 entire towns were closed down, the hospitals were closed down, every industry was closed down, everyone was quarantined at home. The Defence Force moved in to keep essential services running, including the emergency room and including running the hospital. But everyone else was in lockdown for a period while we got a handle on that particular outbreak. And we expect we will continue to get these little spikes occurring over the weeks and months ahead as we learn how to live with COVID-19. Interestingly, there's discussions about opening the border with New Zealand, which has had a similar outbreak to Australia and has managed to contain it, and then perhaps extend the opening the borders to the countries, particularly the island nations across the South Pacific, where Australia and New Zealand work very close partnership with many of those nations as well. So it's an interesting time ahead. We are well aware that there are risks with Australia's approach, with such a small number of people who've been exposed. It may mean that we don't have any antibodies being developed, but of course we don't know what antibody development means with COVID-19 yet. We don't know how long any protection may last if you've been exposed the first time. We don't know if we're going to get new strains developing. There's still so much unknown factors here, but what is known is the important work of general practice and the important work that we're all doing as GPs in keeping the health system afloat to protect your patients and protect the communities where you're based. So thank you for all that you're doing.
Today I've been talking to Professor Michael Kidd, a GP colleague and Deputy CMO for Australia. Michael, thank you very much indeed.
Thanks, Donald. Thanks to you all.